Hello, good evening, viewers, and thank you for joining us this evening. We're coming to you live from TBN Studios, and we are coming to you with your favorite medical show, Ask Dr. SAW. As usual, Dr. SAW is here with us, but he last time we spoke, he was in England, then he was in America, Canada, he's in Italy today. But Dr. SAW, you're still here, and I thank you for still committing, although you're traveling, to this show.
No, indeed. Thanks again, Akasha. It's a pleasure to be in the show, and you guys have done an amazing job, motivated me as well, because when I'm traveling or if I'm on holiday, sometimes you feel, I can skip a week, but then you call up and say, Dave, we got to keep it going. So I think thanks to you for doing that and for motivating me and to the viewers.
Well, yeah, you know what, we have a responsibility to our viewers. We bring them information on based on health issues and medical issues, and also we also answer questions that might be they might be looking forward to those answers very urgently. And so again, Doc, thanks again for taking time out from your busy schedule to be with us this evening. We have a few questions this evening, so we're just going to do half an hour. 4 questions from last week, so we're just going to do half an hour. At the end of 25 minutes, we're going to deal with those questions. So today, I just want to ask you, we're going to be talking about abdominal pains. And first, I want to start by asking you something. Look, as a kid growing up, I used to hear a lot about, every time I stump my toe or I lift something, my grandmother used to say, get Nara. And I used to get severe abdominal pains. And she would, back then you say, you hal in Nara, right?
Correct.
Yeah. Right. And for some reason or the other, we got relief. But abdominal pains seem to be very, very common from children all the way into possibly in your 90s or as old as you get. Why is it so common? Why is it so common, Doc?
I mean, simple reason. Okay, indeed, abdominal pain. The simple reason that it affects everybody, and it affects everybody at some point in their life, because almost all our systems, our working organs, are in the abdomen. Put it that way. Mm-hmm. That's the only reason I can explain.
Right.
I mean, because when we look at the causes of abdominal pain, it's about all the diseases in the world can give rise to abdominal pain. So the point is, everything can manifest as pain, and then all the organ systems of our body, they're linked to the abdomen. So besides your musculoskeletal system, which is your arms and legs, and your brain, everything else related to the abdomen. Even in chest, pains from the abdomen can radiate to the chest. So I think that is why it is so common. But why I said it's a topic to at least to start with, to touch on, is that it is, it almost affects everybody at some point in their life or the other. And some people get chronic abdominal pain, which they have it constantly, and it's difficult to, interpret. But the reason for me to do this as well is to really describe abdominal pain in a way where people can understand it. Okay.
Well, Doc, look, as you rightly said, there are so many things going on in this abdominal cavity of ours. We've got all of these amazing things happening there. This like the engine room of the body, and because of that, there are going to be different types of engine failures and pains. How do you then describe the different types of pains? Because what might generally be something happening in my bowel, giving me pains, or something happening in my stomach, or something happening to, well, the most one of the most common ones that presents itself and becomes very dangerous is appendicitis. How do you then describe the different types of pain? Because kidney pains, I can tell you, that one come from the abdomen, that one bad body.
I know you've experienced that.
Yeah.
You told me. But no, indeed, you're right. I mean, actually, you've answered the question better than I did by saying why it's so common. It is the engine room. I like that word.
Yes.
It's like the engine room.
Yeah. We are the engine. Yeah, that's engine room.
No, I like that. But let us come to, as I say, I want patients to be able to describe their pain sometimes, and to give clarity to it. The doctor will help them to do that. And how do we do that? There are some characteristics of pain that we need to to get from the patient as to, okay, tell me about the pain. So if a patient has pain generally, there are a couple of things we want to know about the pain itself, and that will tell us where it's coming from sometimes, or it gives us an idea. And what are the things we look for? So importantly, sometimes patients come to see us and they don't know how to describe their pain. So I always say, let's start with some basic. First of all, tell me where the pain is. So location of the pain is very important. Secondly, I want you to tell me how bad is this pain. On a scale of 1 to 10, how bad is the pain? One being minimal or nothing, and 10 being unbearable. So you tell me where it is, you tell me how bad it is. Then you want to tell me the character of the pain. Is this pain there all the time? Does it go and come? Is it there in the morning, in the afternoon, when I cough, when I sneeze, when I do that? So you want to know character of the pain. You want to also know what makes the pain better or what makes it worse. So we call that aggravating factors and relieving factors. Because all these things will tell us what are the potential causes. And then you want to know what are the associated symptoms. Well, this is crucial. When you talk about the abdomen, when we say what are the associated symptoms, that will then give us an idea as to which organ is affected or which part of the body is affected.
Right.
So those are characteristics you want to at least get patients to think of it. So I would say to patients and to viewers, this is a message I want to send regarding your pain. So whenever someone is experiencing pain or you're experiencing pain, think of those characteristics in your head to tell the doctor. Because sometimes you get into the room and you don't know, the patient is everywhere in describing their pain, and you spend 10 minutes or 20 minutes talking about the pain itself, and because for the first time they're thinking about it and they're not sure. All right, does it go and come? Oh, I'm not sure. Is there aggravating factor, relieving factor? Are there associated symptoms? Does it occur when I open my bowel? Does it get better when I vomit? Does it get better when I'm constipated? Does it get worse when I eat? So those are very, very important things. And of course, associated symptoms would also be, what else is wrong? Do I have fever with it? So when you're thinking fever, you're thinking there's some infection related to it. So I would say that's how you would want to describe your pain.
So let's take a case scenario here right now, Doc. I'm presenting. You asked the questions, and I said, well, you know what, my pains. It is relieved when I vomit. I feel less pain, and of course when I have a bowel movement, it's easy on me. What do you in such a scenario? What would you think?
Something as simple as that.
Yes.
So look at that. You just tell me those two things.
Right.
And right away, I would say this pain is due to a gastrointestinal problem. So I have decided in my head. Nothing to do with your kidney. Right. Nothing to do with your liver. Nothing to do with, let's say, woman, pelvic organs, your ovaries, your uterus. I would say this person has got a gastrointestinal problem. And then I will zoom in to say, okay, talk about this food. When you eat, so first of all, do you have acid reflux?
Right.
When you eat, does the pain start when you eat? Do you have difficulty swallowing? Do you have hunger pain, or do you have pain when you eat? Because that could tell me when there's irritant, when the food gets into the stomach, it irritates. Let's say you have a cancer or you have an ulcer, it can irritate that. Let's say you have the pain when you're hungry, also gastritis, inflamed stomach. The acid is there without the meal, without food in it. So these are little things. But to break it down again a little bit further, looking at location. So I'd like to describe pain to patients and say, the abdomen, let us divide it into 4. So we use the navel as a middle. You draw a line straight down the navel, downward, and you draw one across. And the abdomen now is got 4 quadrants. So think about a line where the middle is in the navel.
Right.
Straight along longitudinally,
yes,
and straight down vertically. So then you describe what is called a right upper quadrant, left upper quadrant, right, and then you get lower quadrant. So 4 parts.
That's
four
right,
quadrants.
yes.
Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. That's a simple way. There are other times we can divide it into 9 sections. Now, so if somebody come and say, I have a pain in my lower quadrant, my right lower quadrant, you're thinking appendicitis.
Yes.
Because that's where the organ is. Somebody say they have a pain in their right upper quadrant, you're thinking gallbladder.
Yes, that's where the liver and everything is there. Yeah.
Right, on the right upper quadrant, so that's the right side. So your abdomen, you have your chest and your thorax, we call it the thorax, the upper part, and then below the thorax is abdomen up to your groin, right? That, I mean, for examination purposes, when we talk about abdomen, we include the genitals.
Okay.
As part of the abdominal examination. But for simplicity, so we divide it in that 4 parts. And then you look at the location, you look at the symptoms will tell you, so the location will tell me what are the possible organs involved. And then I always say to patients, when we talk about associated symptoms, we are talking about, is this pain related to food and bowel movement and eating? Then you're thinking gastrointestinal. So the abdomen now has got different systems, and I will just name a couple of the systems. You have the gastrointestinal system, so you can get pain as a result that arise from the gastrointestinal system. You can get pain that is arising from the urological system. Urology mean kidney and urinary system. So the urological system. You can get pain related to the gynecologic system. So that's woman pain now. Pelvic pain, your uterus, your ovaries. Pregnancy, period, problem, fibroids, ovary problems. So you have gynecologic, you have gastrointestinal, and you have urologic. And those are the common ones. And of course, muscular pain and hernia, and those are like the structural pains, right? So when you have hernia, or you can have pain from other causes like, abscesses and stuff like that. But let us focus on how do we decipher the pain to understand where it's coming from, and then I'll touch on a little bit of the organs to look at some of the possible causes.
Right.
So let's just look at the right upper quadrant. Right upper quadrant would be on the right side, upper part, from the navel upward on the right side. So always you're thinking gallbladder, you're thinking liver. So if you have hepatitis, gallbladder, we talked about gallbladder last week.
Yes.
So things like gallstones and things like that, or infection of the gallbladder is called cholecystitis. Liver hepatitis. You're thinking about pancreas as well. So you could get that in the right or you could get that in the left. So stomach and pancreas, they can be either, we call it upper abdomen, right? So they can either be right or left, depending on if they're radiating. And sometimes it's not quite exact as to how do you locate it. It can be, located at a point and it's a little bit diffuse. So it doesn't point to one specific point, it spreads. So patients are going to have difficulty. But just telling you upper abdomen, lower abdomen, right abdomen, left abdomen. If I go on the left side, what organ do we have on the left upper now? So left upper, I would say you have your spleen, and then you have kidney there. So the kidney is also both, 2 kidneys you have, right upper, left upper. But also the kidney one now tend to radiate to the back.
Right.
Because the kidney is more posterior organ, so it's more at the back. So you have that. But there's a connecting tube that runs from the kidneys, from the upper part now, it runs to the bladder. So it comes in the middle. So kidney stones can give you pain all the way from the top or the back or the abdomen down to the bottom to your bladder or your groin.
I know that too well. Right,
you know that too well. And we spoke about kidney in previous episodes. Pancreas, we talk about that. So pancreas will also link to digestion. So liver, gallbladder, pancreas, they're linked to digestion. and you may have digestive symptoms. You have acid reflux, you have heartburns. We talked about that before, and you have change in bowel habit. So if you have diarrhea or constipation with acidity problem, that is gastric. So it could be anywhere from the stomach all the way to the bowel, to the anus, and then you have pains related to that. With a kidney, you would have pains related to the kidney where it is located, and it can go all the way down to the groin, to the pelvis, to that. Then for women, gynecologic now, you want to say, okay, are you getting other gynecologic symptoms? Do you have vaginal discharge? So if someone says, I've got abdominal pain with vaginal discharge, I would think, okay, could this be a pelvic infection? So we call that PID, pelvic inflammatory disease.
Okay.
So things like you can get tube problems, inflammation of the tube. Then you have your ovaries on both sides. So we go now lower. Left lower, right lower, you have your ovaries. And of course, the ovaries, you can have cysts of the ovaries, and you can have bleeding into the cyst, can cause pain. The ovaries also, in some people, it's very rare, but you can have the ovaries twisted. We call that torsion, ovarian torsion.
Wow.
So you want to pick that up. Importantly in women, so the common things in women we would say for pelvic pain would be endometriosis. So PID, pelvic inflammatory disease, they will have that, and they can have endometriosis. We talked about that before when we talked about PV bleed. So if viewers can go to the previous episodes on vagina, we talk about bleeding. Vagina.
That's right. We talk about bleeding. Yes.
Yeah, there's a topic on that. So you get that, and you get adenomyosis as well. You get fibroids. These are the gynecologic thing. But patients will come and tell you, I'm having heavy period. I'm having irregular period. I'm having vaginal discharge. So that's your gynecologic causes. And of course, importantly in young patients, pregnancy always got to be eliminated because those are emergencies. You can have tubal pregnancy where the pregnancy is in the tube, that is the fallopian tube. Now, as it grows, the tube is too small for it to stay there, and of course that's not a place for it to be, and it bursts the tube. And you can bleed to death if you don't, find it out early and attend to it as a medical emergency. What else?
So that's what that brings me to my next question actually, because I always want to know what are the extremes of these conditions and when they can kill us. So I want to ask though, what are some red flags and other dangerous symptoms that the moment you feel something or something's happening, look, you need to get to the hospital right away?
Absolutely. So let's start. We will start in each quadrant again. I'll tell you some red flag symptoms. So patients with right upper quadrant, so right upper part of the abdomen, if they have fever, with pain on that right side, with yellow eyes, and their stool color, clay color, that is whitish stool, or dark urine. We're talking about gallstones.
Last week, yes.
Last week.
Yeah.
So that's a medical emergency. Second, pancreatitis. They will have pains in the middle of their stomach. The upper stomach, they may vomit, they have severe pain, blood pressure drop, pulse goes up, they're going into shock. You get pancreatitis can present, especially, let's say they had a binging episode of drinking. So last night I went to binge. Today I'm vomiting, I'm in excruciating pain, I'm sweating. Emergency, that can cause pancreatitis. Gallstone as well, that yellow eye, yellow eyes, if a gallstone gets stuck and it blocking the flow of pancreatic juices, it can cause pancreatitis. So that's a medical emergency as well. Coming into the left side, it will be both right and left upper. The spleen doesn't give you so much a problem unless you have an injury to the spleen. You can bleed, or patients who are thalassemic or who have got enlarged spleen, they can have injury easily. So and then they would bleed. So that's a big problem. But coming on the right and left upper again is your kidney. On the kidney you would have infection. So the infection, pyelonephritis would be the danger one, can give you sepsis. So the danger sign there, the red flag would be severe pain in the back, upper back, that goes down with urinary symptoms and with fever. So with pyelonephritis, you have high temperature fever. You come down now, you can have bowel obstruction. Now that can present anyhow. The bowel is obstructed, it's twisted, you can't pass a bowel, your bowel is blocked, and you're vomiting, and your tummy is swollen. So you have distension, not passing stool, and you're vomiting. That is bowel obstruction until proven otherwise. So we call these conditions acute abdomen. And you touch the abdomen, the patient is jumping.
Right.
So you have what we call rebound. So if there's a hole in the abdomen and the bowel, they cause air into the abdomen, and that irritates or if there's blood or air, it irritates the abdomen, and you have an acute abdomen. Appendicitis. So that's the right lower quadrant. So lower down now, the right side would be appendicitis, where you have fever. So you have fever, pain at that point. So there's that lower quadrant, you touch it and it's very painful. And of course, you tend to see it in the younger patients. And then of course, we talk about ectopic pregnancy. So you're pregnant, or even if you don't know you're pregnant, you're getting pain by the ovaries, by the tubes around that area, right or left side. That's a medical emergency, especially if you feel clammy, cold, your eyes are pale. So those are signs of bleeding. You do a pregnancy test, you're positive. And again, if you have abscess into the tubes, when you have pelvic inflammatory disease, you have fever, you have abscess formation, you'll get a mass or something. Those are the emergencies, or people who are bleeding profusely from the vaginal bleed. I know I'm rushing.
No, that's all right. We're not rushing. We're actually right on time. We're doing great on time.
We're doing well.
Viewers, remember, thank you so much, viewers, for being here with us. You can continue to send in your questions, and next week we're going to answer those questions for you. I hope you're enjoying this show this evening, and please send this send this to your family and friends, because abdominal pain affects us all. Or would have affected us all, and nothing to say it wouldn't affect us in the future. Doc, I want to get into this quickly, and I suppose if you can do both together, so that in us looking at time, how do we investigate abdominal pains generally, and if you can talk about some treatment. Or I don't know if you can be able to get into treatments also, and what are some of the treatments you can use?
Okay,
specific things.
Yeah, so let me just spend the next 5 minutes quickly.
Yes.
But I want to highlight one important thing.
Sure.
When we talk about red flags, so you know when to present to the doctor, so you don't sit with your pain and waiting, right, I'm going to see how it goes. You know, these things, they can actually be fatal, they can kill you. You want to see a doctor, you want to go to the emergency room, you want to be seen. Temperature, fever with abdominal pain, bleeding. So if you have bleeding with abdominal pain, that is vaginal bleeding or blood in the stool, rectal bleeding, vaginal pain, you want to see the, abdominal pain with bleeding, you want to see the doctor. Now, importantly, cancer is a big deal with abdominal pain.
Right.
Lots of cancer present with abdominal pain. So anyone with weight loss, so we always emphasize cancer can lead to weight loss. Anyone with weight loss, abdominal pain, we want to investigate them for cancer, and you're looking for the other things to tell us what organ is involved. Where is this? Is there cancer? Where is it coming from? So if you get bleeding in your stool, weight loss, abdominal pain, without a doubt you have to ensure that it is not cancer. Women with ovary cancer, ovarian cancer, sometimes they don't have symptoms. You get a tummy pain, niggly tummy pain for years or months before you see the doctor, and we do. And we find out it's cancer. So bloating, they can have bloating symptoms with that. And then pancreatitis can also, those are the urgent ones. In terms of investigations, importantly, common things are common. If you have fever with abdominal pain, we want to make sure you're not septic. We want to do a blood test. So a blood test would be a good way to start. Your inflammatory markers will be high. We want to know if you're anemic, if you're losing blood. Then you may not see the blood. You have what we call hidden blood. So if you're anemic and you have abdominal pain, we again go looking for cancer. If you have you're anemic and you're bleeding, like ectopic pregnancy or something, we're looking for all those things. So full blood count we start with. A very simple investigation that is non-invasive would also be an ultrasound scan. So the organ of the abdomen, the organs that you have, your liver, your gallbladder, your pancreas, your spleen, a normal scan, that ultrasound,
Right, right.
maybe they do that ultrasound scan, that can tell us a lot. But ultrasound is not sensitive in picking up bowel pain. And by far, the most common innocent abdominal pain, when you get NARA, those were pain that was coming from you. NARA, as you described.
Yes, sorry. Yes, indeed. Yeah.
That's the one where it's coming from the bowel spasm. We call that, I don't know.
Yeah.
I mean, for me, my medical interpretation will be spasm of your intestine. And an ultrasound cannot show that.
Right.
Generally, the ultrasound will show other parts of your organs, like your liver, kidney, spleen. To investigate the bowel, it's a different ball game in terms of what can we do. There are lots of tests can be done. You can start with simple thing. A plain abdominal X-ray can tell you if you're constipated, if you have bowel loops that are dilated, expanding, and and of course, if you can't find a cause from those preliminary investigations, then we have things like CT scan, we have camera, putting camera top and bottom, and then when it comes to gallstone, there are other things you can do where you put a camera into the bile duct and, looking for those things. But that's your investigation. In summary, we can also put camera into the bladder. So besides camera going from your back passage, your mouth, camera can go into your uterus, camera can also go into your bladder.
All right.
So those are direct visualization.
All right, good.
In terms of treatment, I don't think we can do treatment because in terms of, there's no specific treatment as besides pain.
Exactly, you're right. Because there are different things happening there.
There are different things, exactly.
Yeah.
So knowing the cause of the pain now will then determine how do we treat it.
Yeah.
You have gallstone, this is what we're going to do. You have appendicitis, you're going to have a surgery for that. You have hepatitis, this is what we're going to treat it. So depending on those causes, we will decide the treatment. So in future episodes, I think what we will do is to try to zoom in on individual causes, individual topics, and then.
Well, but that's what we do. That's what we do anyway. So if you want to know something about cancer and so on, and or any you just those episodes. Yeah. But just before I go to the questions from last week, because we just got a few minutes more, I want to ask you this here. Let's say somebody is getting they're getting these pains. It's beating them down. They're getting to the hospital. Is there anything they can take in the interim, or would you advise them to take in the interim, like a Panadol or so, to ease the pain?
Yeah, of course, without a doubt. Painkiller, your simple painkiller, and pain, as I said, is a pain ladder. You start with paracetamol as the most, the less side effect and the easiest to use. Ibuprofen, those family can be a little bit more dangerous. It can affect the stomach, and also people with kidney issues, it can affect your kidney. So I wouldn't go straight for ibuprofen, which is like Advil and Nurofen. I would say paracetamol would be your easiest one before you see the doctor to describe what pain you've got.
All right, great. We just got about 4 minutes more, and I'm going to get these questions into you very quickly. These are questions from last week. Doc, when a person suffers from gallstone, is it both the stones and the gallbladder is removed?
Generally, yes. So the reason why you want to take the gallbladder out, because if formation of stones in the gallbladder, and the stone move from the gallbladder into the duct. Now, if you have a stone in the duct, you can do where you put a camera into the mouth, straight down to the stomach, and then there's a little tubing there. You fit it in and extract the stone or move the stone. Mm-hmm. So we can remove the stone when it is stuck as a medical emergency, and subsequently go and remove the gallbladder. So the general rule is that you have your gallbladder removed at some point. It doesn't have to be done immediately, but it can be done at some point. In the rare occasion when gallbladder surgery cannot be done, let's say you're a frail patient and you just buying time, you can just dislodge your stone, you can remove the stone. So they have procedures where you can remove the stone and leave the gallbladder, but that is rarely or seldomly done. The general advice is remove the stone as a medical emergency if it is causing a blockage, and then remove the gallbladder. If the stone is not causing a blockage, electively, that is at a future date, you remove the gallbladder.
Okay, great. Doc, having your gallbladder removed, does it cause other complications in other organs?
Yes, so there is something very classically called post-cholecystectomy syndrome. So post-cholecystectomy syndrome is when you have you have your gallbladder removed and you still continue to have symptoms that are gastrointestinal related. So you're still presenting as if you've had gallstones still. So there are some complications you can get. So in manipulation of the gallbladder, you can cause infection, inflammation, bleeding. Well, those are all operative complications. But let's talk about when the gallbladder is removed, patients sometimes end up having indigestion, diarrhea, because the bile flows directly into the intestine. Bile, you can have something called bile acid malabsorption. And the bile causes diarrhea, so that causes diarrhea symptoms. So patients can end up with chronic diarrhea, where they just get diarrhea because they have the gallbladder removed.
Wow.
There's treatment we can give, bile salts and sequestrant, we call them. But the thing is, yes, you can have that. In terms of affecting other organ per se, not organ, but you have symptoms as a result of your gastrointestinal symptom. The only time is if you have stones remaining that affect the pancreas, they get stuck in the pancreatic flow of pancreatic juices and the stone get blocked there, or it affects the liver as a result of that. More gallstones blocking the duct.
Okay.
So you can remove the gallbladder and then you have gallstones still in the duct. So those are the bits. But the common side effect of after the gallbladder is removed would be gastrointestinal, diarrhea, indigestion, bloating, acid reflux, those kind of things.
All right, 2 minutes to go. What are your thoughts on lazy stomach?
Oh, right. That's a condition called gastroparesis. Lazy stomach is more common in diabetics. It's a very rare condition, more common in diabetics. Importantly, however, with this Ozempic drug and Mounjaro drug for weight loss, they can also cause lazy stomach, because it slows the stomach down. So lazy stomach means the stomach slows down. What do? You get symptoms of indigestion. The stomach is not processing the food fast enough and it stays in the stomach. So you get bloating, you get indigestion, you have regurgitation, you want to have reflux symptoms you have. So the thing about it is, if somebody say they have gastroparesis, which is lazy stomach, you can get lazy intestine where you have constipation, that's different, but lazy stomach would be more in diabetics, where the nerve is affected and the stomach gets affected. With newer drugs, as I said, can also give rise to that. Treatment would be you do non-medical treatment for small meals and things like that.
Yes.
And then later on, you can give drug to increase the contraction of the stomach.
All right.
And then surgery is an option as well.
Last question, Doc. This one is, I think this person needs an advice, and probably you can advise. Doc, when someone is sick with the heart, what to do? The person drinking tablets still getting pain.
Well, therefore, it means that, so when they're sick with the heart is a big subject, and I talked about the heart before. You have to know the specific condition of the heart. I suppose this person is alluding to angina. So most pain, when you get pain of the heart, is angina. The other type of heart conditions generally wouldn't cause you pain necessarily. So if you have heart failure, we talk about the heart as a pump. We talk about the heart as it has electrical current problem. So the current one usually wouldn't give you pain. The failure wouldn't necessarily give you pain, but the angina would give you pain. So if you're still using tablets and you're having angina, it means you need to up your dose or add additional tablet, or you need surgical remedy to create back the flow, because you're getting pain as a result of blockage. The blood is not flowing well, so you have to reconnect that blood either medically or surgically. All right. Thank you, Doc. We're out of time. Thank you so much, viewers, for joining us tonight, and hope you can join us next week again, where we answer your questions and be on another show of Ask Dr. SAWH.